Hi everyone, I'm Haley. I'm a first year family medicine resident, and in this video I'm going to talk about how to transition from being a med student to an intern, so going from med school to residency. First off, I'd like to give a big shout out to our sponsors, TrueLearn. If you don't know what TrueLearn is, they are a question bank, and I use them for Comlex level 1, 2, and now 3. They have a lot of great OMM questions, and one thing I really liked about them were some of the OMM questions had video links to like how to actually perform the manipulation. So I liked that. And then they also have a ton of great assessments you can do for Comlex, so definitely check them out if you haven't. I had a few DMs asking like how to prepare for residency, should I study? I would say you can do whatever you want, but I did not study. I don't recommend studying before residency. I didn't do flashcards or anything to prepare. I don't think you need to. You have such a little free time when you're in residency. You should really just use that time before to your advantage. One thing I do regret is not traveling more. I think that would have been a great time to go to Europe or something, because once you start residency, it's hard to find that time to travel for a long period of time to certain distances. Can just be difficult. So if you have the means to do so, I definitely think you should travel if that's something you want to do. So once you start residency, your program should put you through an orientation. Most programs are 2 weeks of orientation. Mine was a month. Every program will be different, but that's a nice way to ease you into everything. After my orientation, I went right on to service month, which is like our inpatient hospital medicine, kind of like internal medicine. And it is the most time consuming, the most stressful. You have a lot more responsibilities, you're having a lot more direct patient care, things like that. So that is our toughest month, and that was the first one. I really struggled that first month with time management and being efficient, because I was learning how to do everything. You're learning medicine, learning how to order things in the EMR. And I ended up having a panic attack my first month. So this is something I can laugh about now, because at that time I thought I was dying, but I wasn't. It was just a panic attack. So I'm just putting this out there because in residency it's very stressful. We see a lot of hard things in medicine. There's a lot of difficult patients. It's just hard. Don't be afraid to ask for help. It doesn't make you weak. It doesn't mean you're a bad doctor at all. These things happen, and just knowing when to be aware and to ask for help is really important. And so I want to throw that out there because everyone struggles, and like I said, it doesn't make you weak or a bad doctor. But anyway, after I was going to therapy for a while, I was much better at managing my time and my stress and my anxiety. Learning how to be efficient and manage everything will take you a while. So give yourself a little bit of grace as you learn everything, okay? As you go on, you'll hopefully develop a flow of how you gather information and how you chart review. So when I'm on service, one thing I do is watch the clock. So I don't, rush through things, but I try to keep an idea of, I should probably be seeing my patients at this time. I should be back here at my workstation at this time to finish my chart review and finish, my assessment and plan. So I'll try to take you through a little bit of the day. So we start at 6 a.m. That's when we get sign out from the overnight person. That usually lasts for 30 minutes. So after 6:30 a.m., I go to my workstation and I'll chart review my patients. By chart review, I mean I'm looking up their labs, I'm looking up their specialists, I am looking up any images that we got that maybe just resulted. Sometimes I'll write down a list of all their medications, if any changes were made, things like that. And then I will usually write down their vitals. I will typically chart review 6:30 to 7:15, depends on how many patients I have and how much I need to look up. After that, I will go and round on my patients. I try not to spend too much time in the patient's room if I can help it, just because it's usually pretty early in the morning. So I try to go in and go out just so they can go back to bed. sometimes that doesn't always happen. Usually I finish seeing my patients around 8 a.m., hopefully like 7:45 and 8 a.m. Go back to my workstation, sit down and finish my chart review. So next we have rounds at 9 a.m. and rounds can last anywhere from an hour to a few hours. Depends on how many patients we have, who our attending is, how sick the patients are, and how efficient we are as interns, okay? So rounds will last anywhere from like 9 a.m. to 11:30 or noon. The longest we've gone is like 12:30. Sometimes that's just how it goes. Also, a lot of our attendings and faculty will teach during rounds, so sometimes it will be a little longer. Depending on when we get out of rounds, then I go back to the workstation, put in any orders that we decide to put in, make changes, finish my notes hopefully, and then grab lunch or grab a snack. Then I go and try and see my patients again in the afternoon. That doesn't always happen if we have a lot of admits coming in, but I try my best. So that's how a typical day will go. If we get an admit, we do the H&P, we put the orders in, and then we're done at 6 p.m. And then we have sign out at 6 p.m. for the night person, and that usually lasts, again, 30 minutes. So until 6:30, sometimes I do have to stay late to finish my notes, so it all depends. Alright, transitioning to residency for work-life balance. This was a big one I had as well in my question box. I try to maintain a good work-life balance. As a med student, I think I had more time for exercising. As a resident, I still try to fit in a walk or workout. It honestly depends on the rotation I'm on and how many hours I'm working. But I'll try to have a good work-life balance there. I have, a lot of weekends off, so I try to use my weekends to their full advantage. But usually I'm so tired by the end of the week that I kind of just like to relax and bum out. My husband and I will try to have a date night once a week, so sometimes that's on the weekends, depends on if I'm working or not. But work-life balance is hard, but you just try to squeeze those things in when you can. But those are some of my biggest pieces of advice as you transition from med student to residency. Give yourself some time to adjust. Alright guys, thanks for watching my YouTube video on transitioning from med student to residency. If you have any questions, comments, or concerns, you can comment below on this YouTube video. Make sure you like and subscribe to my channel and follow me on Instagram. Alright, thanks for watching. Bye.